Here is a central line dressing change procedure using a 3M Tegaderm CHG dressing. We will be using a PICC line for this video, however the dressing procedure remains the same for a VASCATH or a PermaCath used for hemodialysis. And please remember, any central line dressing must be changed if the dressing has become loose, soiled or compromised in any other way, if there is a visible drainage outside the gel pad, if the site is obscured or no longer visible, and if the dressing appears to be saturated or overly swollen, which you can confirm by palpating the gel pad. Otherwise, the dressing has to be changed every 7 days, and the day of the dressing application counts as the first day. Prior to dressing application, obtain a PICC line dressing change kit, a 3M Kevlon no sting barrier film, a 3M Tegaderm CHG dressing, 3 hand hygiene wipes, and a surgical mask. Explain the procedure to the patient and place the mask on the patient. Don clean gloves, disinfect a flat surface, and wait for 2 minutes. While waiting, remove the gloves, perform hand hygiene. Open the dressing kit. Remove the top completely. Put on the mask. Set aside the sterile gloves. Create a sterile field on a flat surface with a drape from the dressing kit. Put on clean gloves and remove the old dressing. Carefully remove the securement tape strip from the dressing. First the belt. Use a low and slow removal technique. Begin the dressing removal where the catheter exits the dressing towards the catheter insertion side. Remove the pants. Stabilize the catheter during dressing removal. When the CHG gel pad is exposed, grasp and lift the corner of the gel pad and the transparent film dressing together between the thumb and the finger. Continue the low and slow removal method until the dressing is completely off. Remove the gloves and perform hand hygiene. Open the Tegaderm CHG dressing package and drop the dressing on the sterile field. Open the Kevlon barrier film package so that the stick is uncovered. Do not touch the swab stick and place the open end on the corner of the sterile field. Put on the sterile gloves. Retrieve the ChloraPrep on-step sponge applicator. Pinch the wings of the applicator only once to activate the ampule and release the solution. Gently press the applicator against the treatment area to distribute solution throughout the sponge evenly. Apply the antimicrobial prep to a region larger than the area where the dressing will be placed. Clean dry sites, arm, chest and neck with CHG solution using gentle back and forth motions for at least 30 seconds. Wait another 30 seconds to expose the area properly. Allow the site to dry. Grasp the handle of the Kevlar no-sting barrier film and push off the foil packet without touching the outer surface of it. Apply evenly to the skin and avoid the area immediately surrounding the insertion site and where the CHG gel pad is placed. Wait for the product to dry at least 30 seconds. Application of the Tegaderm CHG dressing. Remove the liner to expose the adhesive part of the dressing, the shirt. Do not stretch the dressing during the application and fold the dressing into a taco shape. With the adhesive side of the dressing facing the skin, center the gel pad over the catheter insertion side and, if possible, try to cover the suture sites. Apply firm pressure over the entire dressing to help enhance adhesion. Slowly remove the paper frame in a low and slow manner. Follow the removal of the paper frame with fingertips to reduce lifting of the dressing border. Remove the large notch sterile securement tape strip, the pants, from the paper frame using adhesive-free tabs. This part of the dressing, the pants, is placed under the catheter. Orient the notch tape strip back towards the catheter site. Apply under tubing and overlap back onto the dressing border. Remove the adhesive-free tabs. The smaller tape to secure the junction of the dressing and the securement tape. This part of the dressing is called the belt. Apply firm but gentle pressure over all surfaces to maximize adhesion. Remove the gloves and perform hand hygiene. Initial and date the smaller tape strip, the belt.